Come closer. Let's talk about fibroids. Many women have fibroids and don't even know until it becomes a serious problem for them. According to World Health Organization, 7 out of 10 women will develop fibroid in their lifetime. But here's the problem: many won't know. Many women only discover fibroid when they are trying to get pregnant or when they are in severe pain. In today's video, I will show you why fibroids are common and what you must do before it is too late. So stay with me to the end of this video to find out how. How fibroid quietly destroys your health. Fibroids are found inside your uterus, that is your womb. The location of fibroid is inside your womb. Okay, so and fibroids are not cancers. That is, they are benign. When I say benign, I'm saying that it is not a cancer. As you know, cancer is a deadly disease that spreads around the body. But fibroid is not a cancer, so it will remain within the womb where it started growing. Okay, so and one thing you have to know about fibroid is that it is consisting mainly of muscle. Yes, it is consisting mainly of muscle. The wall of your womb, another word for womb is your uterus. The wall of your womb or uterus is made up of muscle. Okay, they call it smooth muscle. So fibroids develop from those muscles in your womb. I'll show you in the diagram. Okay, and there's something about fibroid. It can start very small, like a seed, very small, and even grow to the extent of becoming so big, like a watermelon. So, and fibroid can be found in various places inside your womb. Okay, your womb has a wall. It has a thick muscle, and then it has an outer part of the womb. Okay, so there are various. These 3 places I have mentioned are the places where fibroid can be found. Okay, so we have number 1, we have intramural fibroids. Intramural fibroid. Now that is the most common type of fibroid. Intramural fibroid is the one that is found within the muscle of your womb. The medical name for the muscle of your womb is called myometrium. Myometrium. That is the medical name or the medical term for the muscle of the womb. So intramural fibroid develop inside the myometrium, that is within the muscle of your womb. Okay, so then we have what we call the submucosal fibroid. Submucosal fibroid. The submucosal fibroid is the one that is actually causes problem most of the time, in the sense that it occupies the space that the baby ought to be growing inside the womb. That is, it blocks that space in the womb. Okay, so submucosal fibroid is found just below the wall of the womb, just found below the wall of the womb, just to put it that way. It's just found below the wall, and it bulges into, it projects into the space inside the womb. So when somebody has a submucosal fibroid, it can prevent the growing baby from growing, and it can even prevent a newly formed baby from planting on the wall of the uterus. No, it's just like when you have a fertilization. That means when the sperm meets the egg, it forms what we call embryo. Okay, so this embryo is like a seed. The way you plant seed inside soil, so that embryo ought to plant in the wall of the womb. But when there's a submucosal fibroid, it will prevent that planting. It will prevent that planting. That is, that planting of embryo in the wall of the womb is what we call implantation in the medical term. Okay, so but submucosal fibroid will prevent that. So it is dangerous for a growing baby because it occupies space. Then we have another type of fibroid. We call it the subserous fibroid. Now, this subserous fibroid is the one that is growing outside the womb. You know, I said one grows, it grows in the wall of the womb. There's one that grows inside the muscle of the womb. Then this one is outside the womb. So this submucosal fibroid is the one that can press on other organs. It can press your It can press your bladder, it can press your intestine and cause problems. It can even press your back and cause back pain. Okay, so then we have another type of fibroid called the cervical fibroid or the cervical fibroids. Okay, that's the cervix is the mouth of your womb. So this cervical fibroid is found at the mouth of your womb. So that one can cause pain during sex and make sex less enjoyable. And again, it can also prevent the sperm from traveling through the womb to meet the egg. Okay, so leading to problems with getting pregnant. So then there's another type of fibroids called the pedunculated fibroid. Pedunculated. Okay, maybe that sounds like a big word, but don't bite your tongue when you're trying to pronounce it. Pedunculated fibroid. So pedunculated fibroid is the type of fibroid that hangs on something thin like a thread. You know the way mango hangs on a tree. There's something connecting the mango to the branch. Okay, so this fibroid can be like this. Then there's something small, just thin, connecting it to the wall of the womb. So that is what we call pedunculated fibroid. So we have talked about the various types of fibroid: the intramural fibroid, submucosal fibroid, the subserous fibroid, the cervical fibroid, the pedunculated fibroid. So, let's move on to more things about fibroid. So, the thing about fibroid is that many women who have fibroid will have no symptom. That means they will just have the fibroid and they will show no sign that they have fibroid. Even they themselves will not know. So that will not give them a sense, a false sense or a false idea that everything is okay with them. So that's why you have to listen to this video to see how to be able to discover fibroid quickly and take action before it starts causing you problem. So what are the things that can happen if you don't detect that you have fibroid early enough? Let's take it step by step. Number one, fertility problems. Fertility problems. Many women cannot get pregnant because they have fibroid. So fibroid can cause a woman from getting pregnant. Another thing again is that fibroid can cause painful sex. I know I told you about this cervical fibroid, the one found in the mouth, around the mouth of the womb. That one can cause pain during sex, especially when the man is penetrating. Okay, so that cervical fibroid can cause painful sex and make the woman not want to have sex. Okay, another thing again is that fibroid, even when the sperm now meets the egg, you know, I said it will form what we call embryo, Abi, and it's that embryo that we now plant on the wall of the womb, just like the way you plant seed into the soil. So if there's fibroid blocking where the embryo ought to plant on the wall of the womb, what will happen? The embryo will not be able to plant and receive nutrient from the mother. Okay, so it will now lead to failure of implantation. Okay, and the woman will not be able to carry pregnancy. Okay, so another thing is that the fibroid can completely stop the sperm from meeting the egg, especially the one that is at the mouth of the womb. You know, when the man deposits the sperm will travel through the mouth of the womb and go and meet the egg. Okay, so if there's something blocking the mouth of the womb, what will happen? The sperm will remain outside the womb and not be able to enter. So, and that is one of the reasons why some people, they've been married for some years and they cannot get pregnant. So sometimes too, I want you to know that some people can have fibroid and still get pregnant and even deliver. So it's not only fibroid that can stop a person from getting pregnant. So there are many women, I've heard many testimonies, seen many women that have fibroids that got pregnant and they still deliver. Okay, so I'm not trying to scare you. You can have fibroid and still be pregnant and carry that pregnancy. Okay, but sometimes when the pregnancy even enter, some complications can develop. You know, it's like that womb is the thing that is supposed to occupy that place is a baby that is growing. So if something else is now occupying that space, you know there will be problems. Okay, so one of the things that can happen when a woman gets pregnant and has fibroid is that she can have miscarriages, repeated miscarriages, okay? Then if the woman also get pregnant, because something is inside the womb and the baby is there too, so you know it is going to be stretching the womb too much, so the woman can be having pain during pregnancy. Yes, I've had several cases where women come because of they're having pain in pregnancy and we have to admit them, okay, and until the pain subsides. So another thing is that the fibroid can prevent the baby from growing, okay, because it's occupying space. The baby cannot expand and grow as it should. That is what we call intrauterine growth restriction. That means the baby inside the womb cannot grow because something else is preventing it from growing. Okay, another thing that can happen is if you escape all of these things, what usually happens with women that have fibroid with pregnancy is that they have to deliver through CS. Okay, I'm not saying that cesarean section is bad. CS is not a bad thing, but I'm just trying to tell you that fibroid with pregnancy will lead to, most likely lead to CS. Okay, because the fibroid will be blocking the baby. So even if the woman is pushing, it will not allow the baby to come out. So they will just, the gynecologist or obstetrician will just say, let us go for CS. So those are the things you should take note of. So another thing about fibroid, this one is very, 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 very important. One thing about fibroid is that it can cause heavy menstrual bleeding. Have you noticed that your bleeding, your bleeding is during menses is becoming very heavy? Formerly, you are using 2 pads. Now you are using 5, 6, 7, 8 pads. Okay, so your bleeding has become very heavy. So fibroid can be a cause of heavy menstrual bleeding. Fibroid, in fact, is a common cause of heavy menses. If your menstruation dey heavy, you dey pass blood during menses and e no be like that before, just suspect fibroid. Okay, so if a woman is losing so much blood, losing so much blood, what will happen? The woman's blood level will be dropping. That is what we call low PCV. Low PCV is called medically anemia. Okay, so once the blood level is going like down like that, the woman will be getting tired. She do something small, she will get tired. Okay, what we call easy fatigability. She will easily get tired. If you walk small, she'll get tired. Another thing again is that she can have problem with breathing. She becomes breathless. She begins to have shortness of breath because the blood level is low as a result of losing too much blood. And in such a case, if the woman neglects the case, it can actually cause serious problem, including death. Okay, so when the PCV level is dropping so low like that, what we do is that we admit the woman, we try to stop the bleeding, we give a medication like tranexamic acid to stop the bleeding, and then we counsel the woman for surgery to remove the fibroid. So let's proceed. Another thing is that fibroid can make a woman to suffer unnecessarily. What do I mean by that? Fibroid can cause a woman to be having a lower abdominal pain, constant abdominal pain, down. You just be having that pain all the time. What we call chronic pelvic pain. That's what we call it in the medical world. Chronic pelvic pain. And if the fibroid is big enough and it is pressing on your bladder is where your urine dey store, okay, before you pass it out in the bathroom. So if the fibroid is big enough and is pushing down on your bladder, what will happen is that your bladder will not be able to store as much urine as before. So every time you go urinate, you'll be going to toilet to urinate frequently. Okay, so if the fibroid too is big enough and it is sitting on your intestine, what will happen is that you'll be feeling bloating. Bloating means you will eat food and it will feel like the food is not digesting. You'll be having constipation. Your stomach will feel hard, like this food no gree digest. Okay, so it can cause bloating. And it can, if it is pressing on your back, the muscles and the ligaments of your back, you can be having back pain, like somebody will carry heavy load. So that is fibroid for you. Fibroid can cause back pain, low back pain, okay? And another thing is that people will be congratulating you that you are pregnant because your stomach is coming out, but they don't know that it is not baby that is there. It is fibroid. Okay, so there's actually one comedy I saw. One babalawo want to steal a pregnant woman baby. He thinks say the woman he saw has a big tummy, so he thought that that woman has pregnancy, so he wants to use juju, okay, to steal the baby. So unknown to him, it was fibroid that was in that woman's womb. So as you can guess, what he stole was not baby. What he stole was fibroids. Okay, so those are the things about fibroids. So let's move further on this issue of fibroid. Now, a very important question: what really causes fibroid? What causes fibroid? And what is that thing that makes fibroid to keep growing? What really causes fibroid? Now, I want you to note something. For those of you who believe in too much spiritual things, you are very religious. You say, "Oh, they fire fibroid from my village. It is my village people that did it." Okay, or somebody is pursuing me. So I want you to know that fibroid. I don't know about you, but fibroid that I know from a medical perspective is caused by something else and not somebody firing arrow from the village. Okay, so and it is not just bad luck. It's not like God hates you, that is why you have fibroid, and even people that they don't have fibroid is because God loves them. Okay, so that is not the case. It is actually as a result of our biology, as a result of our makeup. Yeah, so everybody has different makeup. Okay, the way you are is not the same. It's not the same way with another woman. So that different makeup is what is quite responsible for people developing fibroid. And as I told you before, 7 out of 10 women will develop fibroid. So you are not alone in this matter, okay? Before the age of 50, 7 out of 10 women will develop fibroid. So let's look at what are the causes of fibroid. Okay, so there in the body produces chemicals, okay, that helps you to menstruate and helps you to maintain pregnancy as a woman. The body produces chemicals. These chemicals are, we can also say they are hormones. Okay, hormones. Yes, hormones. So these hormones that are responsible for helping you menstruate and also helping you keep pregnancy, it is those hormones too that the fibroid feed on to grow. Okay, so what are these hormones? The two hormones are estrogen and progesterone. Estrogen and progesterone. Estrogen and progesterone. I don't want you to forget that. Okay, estrogen and progesterone. Okay, so that is what acts like a fuel for the fibroid to grow. So the more estrogen you have, the more progesterone you have, the more the fibroid is growing bigger and bigger. So I want you to take note of that. So anything that increases estrogen and progesterone in a woman's body will make fibroids to grow if the fibroid is already there. Okay, so let's look at what are the things that contribute to people having fibroid. Genetics, okay, genes, your gene. Yes, what you inherited from your father and your mother, the thing you inherited from them, those are the things. So you might have inherited the fibroid, the genes that cause fibroid from your parents, okay? So, and it's not your fault. It's not your fault that you inherited a gene from, and you don't even have a control over that. So that is one thing that is responsible for somebody having fibroid and another person not having fibroid, okay? Although there are cases where they may not even inherit the gene from any either parent and still have the fibroid. That can just happen sporadically too, okay? So second thing that can contribute to somebody having fibroid is excess body fat. So if you are having too much fat in your body, you are too fat, I'm not trying to insult you, but try and lose weight. Even me too, I'm trying to lose weight, okay? So excess body fat can predispose you to having fibroid. Why? Because I told you that two hormones or chemicals in the body help fibroids to grow, and estrogen and progesterone. Fat in your body produces estrogen, okay, which will make the fibroid to grow bigger. So the more fat you have, the more estrogen you are producing, and the more the fibroid is growing, okay? So that is it. So excess body fat predisposed to having fibroid and even make the fibroid grow bigger. So another thing is poor diet. You are not eating the right kinds of food. you are not eating right kind of food, can also worsen or make your fibroid even grow faster if you have a smaller one before. So what are the kinds of food that can cause that? We have red meat. Red meat, okay? Yes. So red meat makes your body inflamed. So let me see how to break it down for you. Inflammation in the body is like fire, okay? Fire in the body is like fire in the body. So fire by itself is not a bad thing. You can use fire to cook, you can use fire to do a lot of wonderful things. But what will happen if the fire is not controlled? It can burn down a house, it can kill, okay? So that is the same way. So inflammation by itself, which I liken to fire, is not a bad thing. In fact, it is good. The body uses inflammation to eradicate, to remove harmful organism or dangerous organism from your body. So the body uses inflammation. But when the inflammation goes out of control, it can now even start destroying the good organs in your body. So that is the way. So one thing about red meat like cow meat, goat meat, okay, red meat, if you know red meat. So one thing about red meat is that they make this inflammation, which is a good thing, to go out of control. Just like somebody makes the fire to go out of control and burn down buildings. So red meat increases inflammation, and fibroids like an environment where there is too much inflammation. So that is how poor diet like red meat can actually promote fibroid growth. We have insulin resistance. Insulin resistance increases estrogen stimulation. Okay, so when you have too much insulin in your body, that is insulin resistance. You know what produces insulin is an organ called the pancreas. Now, this insulin helps the body to use glucose so that so that the cells of the body can absorb glucose and use it to produce energy that you use to walk, speak, and do a lot of things. Okay, so but in case of insulin resistance, the body is not responding to insulin as it's supposed. So you now have what we call insulin resistance. Insulin resistance. So in the case of insulin also increases estrogen. Insulin increases estrogen. So when there's too much insulin in the body, what will happen? Estrogen will also increase. Okay, so there are things that make the body have insulin resistance. Okay, if you have excess body fat, there will be insulin resistance. That insulin resistance too will cause estrogen to increase. Remember, I also told you that even fat itself produces estrogen. So you see, that is double wahala for somebody that is that is too fat. Okay, so if you are always eating all this refined food, all this food of flour that is made from flour, like a puff puff, you like eating donut a lot, you like eating egg roll, those are refined food made from flour, okay? So eating those kind of food always will make your body resistant to insulin, and in insulin resistance, what happens? Insulin is increased, and because insulin is increased, estrogen will also rise as well. So take note of that. So, and then for those of you that like putting all manner of things on your body, you see this cream, you rub it on your body. You want to be fair by all means. You want your face to be fair at all costs. You do bleaching, you do this one. Okay, some of this chemical contains substances that resemble estrogen. Okay, so they contain substances that look like estrogen. So as you are putting it on your skin, you are rubbing it on your body, they are getting into your bloodstream, and fibroid is rejoicing that you are giving it its fuel. So, and they begin to grow bigger. So you should take note that look at whatever you are putting in your body, look at it very well. Look at the components, what makes up that cosmetic you want to apply on your body, and see if there's anyone that has a chemical that acts the same way like estrogen. So we proceed, we move on. So let's look at some dangerous ideas that people have about fibroid. Dangerous myths. dangerous fibroid myths that keep women suffering in silence. So, you know, this is social media. We are in the age of social media. All people are saying all manner of things about fibroid, both the one that is correct to the one that is not correct to. You find it on social media, so you become confused which one is correct and which one is not correct. That is why you should only listen to a qualified medical professional like a doctor, somebody that is trained in that area. You don't listen to every Dick and Harry that is saying one thing or the other. So there are a lot of misconceptions about fibroids. So, and I want to address them and answer the questions about them. Okay. So one of the myths is that fibroid means that the doctor will remove my womb. Okay. It's not true. Having fibroid does not mean that the doctor will remove your womb. Okay. There are other means and method which I will get to later in this video. So make sure you stay to the end so that you can know the various means of dealing with fibroid. So having fibroid does not mean that the doctor will remove your womb. However, there are cases, there are serious, severe cases where the doctor will say, okay, oh, this is what is happening. Especially during surgery, maybe there's a surgical complication. While they were doing the surgery, they might say, if we don't remove this womb, this woman may go. So those are very serious and they are not common cases. Okay. So, but most times there are other means that does not involve removing the womb. Okay. So that, let's get that out of the way. So they say some people think that a fibroid can turn into cancer. No, most of the time fibroids cannot turn into cancer. I told you that fibroids are benign, meaning they are not cancerous. They are not cancerous. So it is very, very, very unlikely. I want you to get that. It is very, very unlikely that fibroid will turn into a cancer. Another misconception or myth about fibroid is that some people say it is only older women that get fibroid. Personally, I have seen very young girls from 26 and even below having fibroids. Okay, so fibroid is not just older women. Fibroids can happen to even very young women, depending on the genetics, what kind of genes they inherited from their parents. Okay, so there are women in their 20s and 30s who have developed fibroid. So this one is very common. When a woman discovers she has fibroid, then you will hear one auntie somewhere say, come, there's one drug I will give you. It will shrink the fibroid. It will make the fibroid it will dissolve the fibroid. My sister, na lie. There's no drug that will dissolve fibroid. There's no herbal medication that they are selling that will shrink fibroid. You will find out that if you are taking the medication, nothing is happening. I have seen this many times. I will see one woman will diagnose fibroid. Before you know, she has gone to buy one expensive herbal medication for 30K. And she will start taking it. After she takes it for some months, she will go back, do the scan. The fibroid is still there, kidigba. So there's no herbal medication that will shrink or dissolve fibroid. Okay, so they're just eating your money. So let's proceed on this topic. So how do you detect, stop, and control fibroid before it gets worse? Okay, so number one is to detect it early. Detect it early before even the symptoms appear. So what do? You should, as a woman, every year, at least once a year, you should be doing what we call pelvic ultrasound scan. Pelvic ultrasound scan. So you can the sonographer or radiologist will look into your womb and take a picture of your womb. Yeah, so and they can print out the result for you to keep. Okay, so pelvic ultrasound scan is a way to detect fibroids early. So it is recommended that you do this at least once a year or twice a year. Okay. Another thing is that you should be observant. Be very observant. If your period is changing, maybe formerly you are using 2 pads, now you find out that you are using 6 pads in a day, then it shows that you should go to the hospital and get evaluated so that if it is fibroid, it can be picked out early and something can be done about it. So I've already said it that removing the womb is not the only option that is available in treatment of fibroids. There are other ones which I want to go into now. So open your ears wide. Let me tell you the other options so that nobody will come and deceive you that because you have fibroid, they must remove your womb. Okay. So another one way of dealing with fibroid is by surgery, and that surgery is called myomectomy. Myomectomy does not involve removing the whole womb. What the doctor, the or a gynecologist do in that instance is that they go into the theater, they open your abdomen, and then they open up the womb and remove the fibroid one by one. They remove it, okay? They remove the fibroid one by one, and then they close you up back, okay? So that is myomectomy. So the womb is spared, but the fibroid is removed. So there's another treatment option, but however, it has not become as common. We have what we call uterine artery embolization, UAE. I'm not talking about United Arab Emirates, so I'm talking about uterine artery embolization. So what is this procedure like? Now you have to know something, that a fibroid is growing. It means that something is supplying it blood and nutrients, okay? Something is supplying it. Okay, so there are blood vessels, like pipes, supplying the fibroid with nutrients and blood supply and all of that. So what uterine artery embolization do in this case is that they will go to the fibroid and block the blood, the pipe that is supplying the fibroid. Okay, that is called uterine artery embolization. So, but I've not seen it so commonly done. The one that I see so commonly done is myomectomy. Okay, so although there are medications that can shrink fibroids, we have there are some medications that can shrink fibroid actually, okay, but it is not commonly used because they can disturb or destabilize your menstrual cycle. So it is not commonly used, okay. So, but there are medications that can be prescribed by the doctor to shrink fibroid temporarily. Now, usually they shrink the fibroid temporarily so that when they are going to do surgery, so they give this medication before surgery, some months before surgery, in order to shrink the fibroid and make it easier to remove during myomectomy or during surgery. Okay, so that is it. So, how can you reduce your chances of having fibroid? How can you reduce your chances of having fibroid? So let's discuss this one. Now let's talk about this one. We talked about red meat causing inflammation, and that inflammation provides a good environment for fibroid to grow. So what do? Don't reduce your consumption of red meat, okay? Reduce your consumption of red meat and increase your consumption of vegetables. Vegetable contains substances, antioxidants that can help your body generally, okay. So, and that even there's this particular group of vegetables that are particularly helpful in fibroid. We have the cruciferous vegetable. So these cruciferous vegetables are cabbage, broccoli, cauliflower, kale. So those are cruciferous vegetables. Now, these vegetables that I just mentioned, they produce a substance, they produce some substances, okay, that weaken the effect of estrogen. Okay, so because I already told you, if you remember clearly, that estrogen is like the fuel that helps fibroid to grow. So anything that weakens or reduces the effect of estrogen will make fibroid not to grow. Okay, so this cabbage and broccoli, all these cruciferous vegetables, they have a lot of fiber in them too. So these vegetables, they reduce the effects of estrogen. So cabbage, broccoli, they are good. Okay, so food that are also high in fiber generally also reduce the effect of estrogen. That's because they bind to the estrogen and you shit it out, you pass it in stool. Okay, so then if you eat fruits too, fruits are also very good. Antioxidant, they help to repair damage. Fruit contains antioxidant, which helps to repair damage, reduce inflammation generally. So eating a lot of fruit and vegetable will really help. And again, you should watch what you put on your skin. I told you about some cosmetic products that people use that contains xenoestrogen. Xenoestrogen means that they contain substances that look like estrogen. Okay, so and thereby feeding, making fibroid to grow even faster and bigger. So you should watch what you put on your skin, because what you put on your skin will eventually get into your bloodstream. So exercise is also very important. Exercise, that's because exercise will help reduce insulin resistance. I told you about insulin resistance increasing estrogen, which causes the fibroid to grow faster. So the more you exercise, the more your body is become very sensitive to insulin. So the body does not need to pour out too much insulin. It will just pour out a little bit of insulin. So exercise helps you to become very insulin sensitive. Again, exercise also helps your body to balance hormones. It also helps your body to balance hormones. So those are the steps you can take to reduce your chances as a woman from having fibroids. So there's one thing I forgot to add, that the women that are black, that are of African origin. Yes, we are women. We have many women watching this video who are African. Women that are of African origin have 3 times more chances of developing fibroids. That is just nature. Women of African origin have 3 times more chances of developing fibroid compared to the Caucasian or the white people. So just take note of that. So let's see how you can put everything I've been saying into practice. Okay, so what are you going to do now to put everything that I've been saying into practice? I said, if you have not done a scan before, please try and do a pelvic ultrasound scan. Try to do a pelvic ultrasound scan as soon as possible. Then you can do it subsequently every 6 months or every 1 year according to your capacity. And so don't wait for symptoms before you start running around to check for fibroids. No, don't wait for symptoms, okay? So that brings us to the end of this video. I want you to comment on this video. What have you learned in this video? Okay, what questions do you have in mind? And I'll be ready to answer your question. Okay, and also don't forget to share this video. Don't forget to share this video. There may be some other women who need to hear what you have just heard. So share this video, share the link to this video so that you can also watch it and be empowered with knowledge about fibroid. Secondly, or rather lastly, subscribe to this channel. I need your subscription. This channel needs to grow, and this message needs to get out to more people. So bye for now. See you when I see you.